Hi, I'm Karen Hoffman, and I decided to do my research project on whether electronic health record adoption was a good idea in small physician offices. Um, there are three different types of health records: paper records, hybrid, which consist of paper and electronic. With technology changes in the world, facilities should consider changing to all electronic to keep up with these changes. And this would be a good decision for not just large facilities, but small as well. Facilities should take a look at the full picture before making this important decision. Electronic health record adoption. One must weigh the pros and cons before making this decision. Rural areas may have a harder time than urban areas when it comes to EHR implementation due to having, the bigger areas have a larger income, so the rural areas would have a harder time as far as financially. Most facilities with an EHR were satisfied with it and felt it improved patient care. The literature showed that there are both disadvantages and advantages to both paper records and electronic health records. It also looked at statistics involved with both urban and rural physician facilities. My research methodology would be a Likert scale that would be mailed to small physician offices that have already adopted an EHR. It would ask them a series of questions to be rated from 1 to 5 on all aspects of their EHR. Are they satisfied with their EHR? How satisfied are they? And things like that. There will also be a survey sent to all small facilities all local facilities asking questions about their opinions on EHRs regardless if they have implemented one or not. A separate survey would be given to patients as they check out of those facilities. The questions for patients would be about their experience with EHRs. For example, have they used a patient portal, or in their experience with the process of their visit going through faster, things like that, and also if they've had a prescription e-prescribed to them and how satisfied were they with that. And what their opinions on them are, what they've heard about them. All of this would need to be turned in by a specified date on the forms. Paper records have disadvantages and advantages. Obviously, you can see that there's more disadvantages than advantages to this. But the first disadvantage would be unauthorized access. As far as paper records, they're more easily obtained because someone can go into the HIM department if they're authorized and just, pick up the record they need, and it's a lot easier. Improper disposal. After a records retention period is up, it would need to be disposed of properly. Usually this would be shredding. If it's not disposed of properly, then it could be accessed by unauthorized individuals. Disasters is a big one. Whenever there's a disaster such as a fire or flood, records can be destroyed. Sometimes there's precautions made, but sometimes these don't always work. So these records would need to be backed up in some type of way. Paper records also take more time and money. It takes a lot of time for doctors to dictate these records. It takes longer than with an EHR, which ends up actually costing them money because of the time. The last one is that illegible handwriting is really bad with paper records because they have to be handwritten by the doctors, and sometimes their handwriting is really messy, so it's hard for this would cause a problem as far as someone reading the chart, and could cause medical errors and also reimbursement errors when it comes to coders trying to code from their handwriting. There are a few advantages. Having paper records can be convenient and provide you with a hard copy of information, which is always nice. Although there is a risk of unauthorized access, as mentioned before, it is less less likely if there are procedures put into place to avoid this, such as checking in and checking out records so that there's always a record of where it actually is. The training is shorter with paper records than with an EHR because it's not as hard to learn. It's easier to learn how to find things in paper than technology, since technology can be kind of difficult sometimes. EHR advantages, and as you can see here, the disadvantages are less than the advantages. If there is a breach in the system, such as someone somehow being able to get a username and password, maybe someone left it around or something, the patient's PHI can be stolen, and this can, cause a big problem. But this can also be fixed by putting in firewalls and encryption and things like that. This can also cost time and money. Initial cost of setting up an EHR can be pricey, but when meaningful use is reached, facilities can get incentives. And this is really important for small facilities because one of their big things is that they don't have the money to start up an EHR, but if they will invest in it, when they reach meaningful use, they'll be able to get that money back in incentives. And this can also take time to train because it is technology. It would take longer to train. Also, design flaws. If a facility adopts an EHR with a design flaw, it can have poor system usability and inappropriate data capture, to name a few. This can be fixed by researching a variety of EHRs and making sure to find one that fits well. Advantages. Having access controls makes it more secure. Username, password, maybe even a PIN, and things like timeout after a certain amount of time and things like that would prevent people from being able to get on it. People would also need to take the responsibility to make sure they did not share their information with others. It also saves patients time by having to not repeat the same information over and over. So say if they go to one facility, and they go on a visit and they give their information, and then they go to another facility, it's already there. They don't have to repeat it over and over and over. Also saves space as far as you don't have to have filing cabinets, because filing cabinets, as we all know, take up a lot of room. So without having that, it would make it a lot easier to have more room and safer, because filing cabinets are not very safe. Information availability. The availability of information is a lot easier to access with EHRs because physicians can just go to a screen and find the information they need instead of having to flip through pages and pages of information in paper records to find what they need. Release of information is really easy too because release of information can be done in an EHR with a click of a button instead of having to fax or however else it's done depending on the office with paper records. Based on previous surveys, results, and research, it seems that the advantages of EHR adoption in small physician offices is more beneficial than hurtful. Any disadvantage can be fixed with a good plan and strategy. I have concluded that it is a good decision for small facilities based on past studies. It has shown that the pros outweigh the cons. There are many things that can get better with EHR, including better patient care, less errors, things of that nature. Small facilities should research many systems to find out which one will benefit them financially while providing everything they need and providing security for their patients' information. A plan should be put into place for the implementation process, including setting aside time and money in order to get this done. It was found that although smaller facilities are less likely to adopt EHRs, they are not lagging behind the bigger facilities in actually adopting them. So this shows me that it is beneficial because more smaller facilities are adopting them. EHRs are beneficial to all facilities, small and large, and I believe further research will confirm this, including the Likert scale and survey that I made. And here are some of my references. And here's the rest of my references. Thank you so much for your time.